Improving health outcomes is a priority for patients, hospital leadership, clinicians, and policymakers. There are a number of tools and interventions that can be used to improve patient outcomes. Examples include medicines, protocols, medical devices, checklists, diagnostics, staffing, and training. Would it surprise you to know that your hospital's organizational culture is a tool you can use to improve patient outcomes? Groundbreaking research has shown that a hospital's organizational culture could have the same effect as blockbuster medicines. So we know organizational culture matters, but what exactly is organizational culture? There are a lot of ways that people think about organizational culture. We think about organizational culture in 5 domains. Learning environment is how well teams are able to problem solve. Senior management support is maintaining visibility as a champion for improvement. Psychological safety allows team members to express divergent views. Commitment to organization is an employee's sense of attachment to their hospital or organization. And finally, time for improvement allows employees time for planning and feedback. So we know what organizational culture is, and we know that it matters to patient outcomes. But what do we do next? Yale Global Health Leadership Initiative conducted Leadership Saves Lives, the first prospective study to see if organizational culture could be changed within 2 years. From the Mayo Clinic Care Network, Yale selected 10 hospitals that varied in geographic location, size, and teaching status. All 10 hospitals were similar in that they had a high volume of heart attack patients and were at or below average performance in caring for these patients. Each hospital was asked to appoint a guiding coalition of approximately 15 multidisciplinary staff, including EMTs, doctors, nurses, pharmacists, and hospital administrators. This marked the first time that coalition members had worked on such a diverse and multi-sectoral team with professionals within and outside the hospital system. Coalition members were all involved in the care of patients who had suffered from a heart attack. Through workshops and annual meetings, guiding coalitions built skills in foundational leadership and strategic problem solving with the goal of strengthening organizational culture. At the end of 2 years, a systematic analysis showed that 6 hospitals had demonstrated meaningful change in culture, showing that culture change is possible and disproving the long-held belief that it takes 10 years or more to facilitate such change. In addition, the 6 hospitals that showed changes in organizational culture had a significantly greater decrease in risk standardized mortality rates for heart attack patients than the national average. In other words, patient outcomes improved when hospitals invested in organizational culture. Beyond the changes among heart attack patient care, coalition members also expressed the intent to spill the principles of leadership saves lives into other complex health challenges that require coordination and collaboration across the health system. So what did we learn? First, we were able to again illustrate that organizational culture matters to improved health outcomes. And more importantly, we were able to showcase that organizational culture can be changed, and it can be changed in the short term through an intervention like Leadership Saves Lives. So, are you ready to give it a try?